if you know people don't take care of themselves. But now how should we be taking care of ourselves to just prevent any rising cases of arthritis?
Okay, so some of the reasons the cases could be rising is, of course, with better health care, you find that people live longer, and therefore with osteoarthritis being the bulk of the arthritis cases and it being in the elderly, then with time you find that the numbers will rise simply because we're having a bigger elderly population than we had in the past. Then on top of it, because of, you'd say rates of obesity and being overweight have increased with time in the country, then you find that even osteoarthritis, due to being overweight or being obese, will continue, the cases will continue rising for that reason. Other lifestyle factors, if smoking and smoking, alcohol intake, excessive alcohol intake, lack of living sedentary lifestyles also, because you find exercise plays a protective role in preventing arthritis, at least osteoarthritis. So the more sedentary we are, the more overweight we are, the more we smoke or take alcohol, then the cases of osteoarthritis will keep rising.
And on that mention that you've just mentioned, you know, when you talk about physical activity, gym, and just being active, could excessive, you know, gymming and, you know, physical activity expedite cases of arthritis?
Yeah, you do find that for people who are, for sports people, that they are predisposed to osteoarthritis, particularly because of the repeated use or rigorous use of their joints. So osteoarthritis happens because we're losing cartilage. The cartilage is slowly wearing away, and therefore for people who are involved in rigorous physical activity on a repeated basis, then they tend to be predisposed to osteoarthritis. But then in my opinion, I think that in the general population, we are under-exercising anyway. So by the time you have osteoarthritis due to exercise, it has to be someone who's a professional sports person, for example. I don't think in the general population you'll be finding that someone exercised themselves into, you know, developing arthritis. Yeah.
How about somebody who already has it and that are just trying to, you know, work out? So that would mean that if they, you know, exercise excessively, then that could lead to maybe kuanguka tena and just increasing the rate at which that arthritis was already presenting itself.
Actually, that's one of the myths. You had asked me earlier about the myths that exist regarding arthritis. So because with arthritis, you find that with movement, the pain will make you feel that you're worsening the arthritis. But actually, exercise tends to improve the life of one who lives with arthritis. So what it does is just strengthen the joints, and therefore you're able to, you actually slow down the process of the progress of the arthritis. Yeah, so exercise is not bad. It's just a matter of doing gentle exercises that one can handle. Yeah.
I've heard of cases where sometimes, you know, when arthritis starts presenting itself, then somebody will notice things like deformities, say on the legs. It could be bowed legs, knocked knees. How does it get to that point where, you know, somebody who's not born with these deformities now get to that point where they're having now bowed legs, their knees are now knocked?
Yeah.
How does it get to that point?
Okay, so taking it back to the fact that osteoarthritis develops because there's destruction of cartilage, the wear and tear, as we call it in the public. So the loss of cartilage with time means that the bones are rubbing against each other, and the more the bones rub against each other, they kind of form what you call osteophytes, which are excessive bone on the edges of the joints. And so with time, that becomes a joint deformity. And by the time you get there, then most likely we'll need an orthopedic surgeon, that's a bones specialist, to assess you and perhaps even replace the joint. Yeah.
So how about the people who are already born with these disabilities and deformities, those with, say, rickets, knocked knees, bowed legs? while when they now present with this signs of arthritis, then how does it affect them differently from somebody who is now just catching up with, or just getting about legs and these deformities in the later days?
Okay, so already with the rickets, there's reduced range of motion, meaning you may not bend the knee or move in, have the same level of joint mobility or flexibility as a normal person. So when arthritis develops, then that means you're having even worse presentation of that and more reduced mobility, further reduced mobility, further complications of just being unable to function as normally as one would without the complication of rickets. Yeah.
All right. Let's get into the topic of treatment. And a lot of people may wonder, can it be slowed down? Can it be reversed?
Yeah.
Can it be cured? And can it be prevented? Talk to us about that.
So when it comes to osteoarthritis, it's a progressive disease. And to be honest, it has no cure because it's something that is happening due to age. Again, I tend to use the example of your skin aging is not reversible or curable. Yeah. So because it's an aging matter, then you find there's no cure for osteoarthritis. What there is we tend to treat it mainly with painkillers that improve the quality of life, reduce the pain, and therefore enable more function. So these painkillers are often anti-inflammatory because what happens in arthritis is excessive inflammation, and so we are trying to slow down that inflammatory process and therefore improve the quality of life. Then in our practice, often we give supplements that improve the cartilage function or improve at least the cartilage, preserve the cartilage. So these supplements contain minerals and vitamins that preserve cartilage, and therefore that also slows down the symptoms of cartilage loss, which now lead to osteoarthritis. So such supplements include vitamin D, calcium, some collagen supplements, and therefore that helps to slow down the progress of the disease. Again, exercise, physiotherapy plays an important role in increasing the joint mobility, reducing that stiffness that one experiences when they have arthritis. And finally, if you find that the pain is not reducing, then you find that some bone specialist will inject steroids into the joint. So the steroids are also anti-inflammatory. They reduce the inflammation of the joints. And that helps to improve someone's life. With more advanced disease where what you're talking about, the deformities, you get to the point of deformities, then that needs assessment by an orthopedic doctor, bone specialist. And then they may actually require replacement of the joints. Yeah.
And I wanted to ask you that question. I don't know if you're the better person to answer it. But now, say